This is a study here which looked at how effective smartwatches can be to identify irregular heartbeat, published in the New England Journal of Medicine. And what they found was a smartwatch was able to pick up 34% of what got picked up on an EKG. So not as good as an EKG or a Holter monitor that you would typically get prescribed by your cardiologist, but not bad, considering this is not a medical device, it's just a smartwatch. They do pick up about a third of those irregular rhythms, and that's quite impressive. Sleep apnea is also very much connected to brain health. And this was a study which showed that if you have sleep apnea, which is typically clients who have high blood pressure, who snore at night, and what happens is they don't realize, but they're stopping breathing at night, which is called apnea. This study went on for 8.7 years. That's a long study, but it showed that people with moderate to severe sleep apnea had a 2.9 times increased risk of having a stroke. It has been shown that sleep apnea also increases the risk of atrial fibrillation or irregular heartbeat. That's one major reason how a sleep apnea causes a stroke and also causes sudden death. Because if you're lucky, you get an irregular heartbeat. If you're not so lucky, the heart can just stop altogether. Sleep apnea and dementia, like we saw in the previous talk, our brain cleans up during sleep. We have something called glymphatic drainage, which is like the sewer system of how your brain gets rid of toxins. And this happens while you're sleeping. Remember, there are two times when your body is cleaning up, sleeping and fasting. That's the two times when your body gets a chance to clean up. And if your sleep is impaired, then that compromises your cleaning apparatus. And in fact, when we talk about Alzheimer's dementia, which is the most common cause of dementia, the amyloid beta protein plaques and tau protein neurofibrillary tangles, which are pathognomic of Alzheimer's dementia, are essentially debris which couldn't get cleaned up effectively. And this was a study which showed that having sleep apnea increases your risk of dementia or mild cognitive impairment, what you could describe as pre-dementia, by 85%. And we know that sleep apnea also increased your appetite. This was a very smart study in which they gave people with sleep apnea CPAP machines, but they gave one group fake CPAP machines, so these were not actually giving them continuous positive airway pressure, while the other were the real CPAP machines. And what they found was the group of people who got the real CPAP machines, they were consuming on average 454 kilocalories per day less compared to those who got the fake CPAP machines. That's almost 500 calories a day, which would equate to 1 pound or half a kilogram weight gain per week, which would be 4 pounds or 2 kilograms of weight gain per month. And 2 kilograms of weight gain per month over a year, that is 12 months, 24 kilograms or almost 50 pounds of weight gain. And that is just by having sleep apnea and not being on a CPAP machine.